October is Breast Cancer Awareness Month, a time when campaigners around the world educate people on the disease and the importance of early care. Now, while Africa has one of the lowest incidence rates of breast cancer in the world, its mortality rate is higher compared to other regions. Although cancer as a whole is a rapidly growing health concern in Africa, research on the disease still has a long way to go. We'll discuss that a bit later on the program. But first, let's go to Tamale in northern Ghana, where campaigners have been on the streets creating awareness. It's one of the growing number of initiatives to encourage people to get screened to detect cancer early. Some attendees told us why this drive is so important.
I joined to help create awareness to the public, especially the women, though men too are at risk, but I'm more considerate about the women.
2020, I think we had almost about 65 cases, new cases. 2022, we had almost about 68 cases. Then 2022, till now, we've recorded almost about 140 cases, only in the northern parts of Ghana. So that should tell you that breast cancer is really becoming a burden, and therefore the public needs to know about it. That's why we are here to educate.
For more on this, let's bring in Violet Kayamba. She's a researcher and lecturer at the University of Zambia Medical School. Hello and welcome to the program, Madam. October is Breast Cancer Awareness Month, but with all this awareness, how much capability is there on the continent to detect and treat this type of cancer?
Well, basically, the methods that are used for screening don't require much sophisticated equipment, and it's clinical examination and mammography as well, and ultrasound. Physical examination, of course, it can be done without anything. That means it's available everywhere for as long as the people know what to do. Because for breast examination, you have to know exactly how to do it. So as long as the knowledge is there, there's no problem. Ultrasound is widely available on the continent, even in low resource centers. Most ultrasounds are being used for diagnostic purposes for people who've got problems. So using that resource for screening, it's a strain, but otherwise the facility for using ultrasound for breast cancer screening is there in most centers in Africa.
Well, that's definitely good news, right? But what is causing the increased number of cancer cases across the continent? Because the numbers are rising. Is it the lifestyle, what we eat and drink? What is it?
There are two things. The question you have to ask is it a true increase, or is it because our diagnostic capabilities have increased? Remember that when you start screening, then you'll be picking more lesions, you'll be picking more patients, even people who've got really small, tiny cancers that might not manifest into actual disease later on. You're going to pick them and you're going to count them. So sometimes when you go screening for something, you expect the numbers to shoot up. The other thing is that it could be a real increase in that there's a lot of lifestyle changes in Africa, and diet, environment, all these factors are at play. But right now, it's not very easy to actually disaggregate the two. The fact that is it a real increase, or is it because our diagnostic and detection capabilities have actually improved?
I see. Well, cancer is one of the leading causes of death in Africa. What is the state of cancer research on the continent overall?
It's very, very little. In fact, we did a review of literature to try and see how much output is there or how much research is happening in Africa. It's very, very, very little. And it's a large continent with 50-something countries, but very few of those countries are actually doing research. And that is a problem in itself. And that is why even the question on increasing numbers becomes problematic, because there are not many people doing actual research to tell us what the correct numbers are. So everything is based on there's quite a lot of estimates for many countries. The other problem is that there are few countries in Africa that have population-wide cancer registries. So again, that's a problem. How do we know how much disease there is if the registries are not covering all the areas, and including rural areas? So to answer your question in short, there's not much research going on in cancer. from Africa, which is a pity, a problem.
Yeah, I agree. It definitely is a pity. But if we know all of these problems, what are we doing to solve these problems?
For starters, what we're doing right now, talking about it, and I really appreciated when I got your contact to say, like, let's start talking about, let's start having conversation, because advocacy is extremely important. What has made us or enabled us to sort of conquer the HIV epidemic, even COVID as well, is because a lot of people put in resources. It was all over the news. People who've got money, governments, organizations, charities, everyone was alerted to that problem and they put in resources. Once you put in resources in a disease, it's much easier to actually handle it and do research. So the starting point for cancer in Africa is advocacy. We need to start talking about it. We need to start projecting these numbers, making headlines actually to say, look at the number of people who died in this continent, and there's not enough that's being done. Let's start doing something about it.
Right. Violet Kayamba, researcher and lecturer at the University of Zambia Medical School. Thank you very much for your time. Now, prostate cancer is another form of the disease. It is the most commonly diagnosed cancer in men, and the risk increases as men get older. Now, according to research, prostate cancer is more prevalent among Black African men than white men, and is more likely to strike at a younger age. The good news is the disease is treatable if detected early. But the bad news is many men are uncomfortable to even talk about this. DW's Olisa Chukuma takes us to Lagos in Nigeria, a country where 1 in 4 men above the age of 50 face the risk of developing prostate cancer.
Happy to be back on his scooter, 73-year-old Charles Oputa takes a ride around his home in Lagos. Charlie Boy, as he is called, is well known in Nigeria's entertainment scene. But in April this year, he revealed on social media his battle with prostate cancer.
At first, I didn't know what was happening. My prostate cancer had entered my bladder and it just taken over my bladder. Where my pee comes out from, was almost closing. And then because there was waste in my bladder, it started to get cancerous. The next day I was in for surgery. There was no messing around about that. And that was how I was saved.
Prostate cancer is one of the leading causes of death in older men in Nigeria. But studies reveal many still know little about the disease. And some 82% of men over the age of 40 have never been screened or tested.
I have been hearing of prostate cancer, but I don't know which of the sex it affects, whether male or female, I don't know, but I know cancer as a whole is a dangerous sickness.
Personally, I don't know, but of course I would like to know. And at my age now, I know there's a high probability that I'll be having those issues, but I'll definitely like to cross-check and know.
But many wait for too long before getting their checkup, says Professor Odunayo Ekwerowo, a urologist at the Lagos University College of Medicine.
So that's a problem. And because of that, a lot of the patients, by the time they come, it's already advanced disease. They're already coming late. So they're coming at a stage where treatment cannot be curative, So that's a big problem. You can have
the economic realities in Nigeria can make prostate cancer treatment expensive. But the issue of how treatments can affect sexual performance is also a sensitive topic for men.
So you have many people who can afford it. Unfortunately, most of the treatment for prostate cancer will involve loss of erection. Okay, so that's one of the major factors where people, even when they know they have prostate cancer, they may not want to receive treatment or they just disappear. They just need to be properly counseled. Even though it affects your sexuality, not everybody, but when it affects it, we have treatment for that as well.
But first, they must learn about the various treatments available to them. And that is why Charlie Boy hopes that by going public with his prostate cancer, he will help others like him speak about it and take action.
A lot of my friends, a lot of people that I know, have passed on because of this problem, and because they were avoiding, they were not even telling their wives, those ones that are married. That is how bad. And the male ego is something else.
In May, a new law was passed in Nigeria making education about breast, cervical, and prostate cancer compulsory in high schools. But experts still want more to be done in the area of awareness, and they advise men to begin prostate cancer screening from the age of 40 onwards.
Joining me now from Accra, Ghana, is Yao Bediako, a scientist and the CEO of Yamachi Biotechnology, a company focusing on cancer research in Africa. Hello and welcome to the program, sir. Now, you aim to redefine how cancer is diagnosed and treated in Africa. What's the problem with how it's currently being done?
So the problem is not so much an issue of how it's being done in Africa. It's really about how it's done globally. Currently, most cancer research occurs in North America and in Eastern Europe, a little bit in Asia now. But majority of the data that is used, or majority of the patients that are being studied, are people of European ancestry. So the numbers are something like about almost 80% of genomic information, so information on genomes that is available for research, comes from people of European ancestry. Now, people of European ancestry account for less than 10% of the global population. So when you have 80% of your research data coming from less than 10% of your population, that creates an issue. So a lot of what we know about cancer, which is a genetic disease, is driven by mutations in genes in your body. Majority of what we know is from people of European ancestry. So most of the clinical trials that have been run to try to test cancer drugs or test new diagnostics have been done focused on people of European ancestry. And so there is growing evidence that these drugs and some of these diagnostic tools do not work as well in people who are not of European descent. And so there is a need to diversify the research base so that we develop drugs that work in all people, irrespective of where they are from.
I think that's pretty interesting what you say. Have you found anything unique to cancer cases in Africa?
Oh, so there's lots of data. I mean, we are a very new company. We've only been doing this for about 2 years, but there's lots of scientific literature published from people, in the US and in other places who have looked at, other ethnicities, especially looking at people of African descent. And there's clear evidence that certain types of cancer present differently. A good example is breast cancer, where you have this subtype of breast cancer called triple-negative breast cancer. It is much more prevalent in women of African descent than in any other ethnicity. And triple-negative breast cancer happens to be one of the most aggressive forms of breast cancer and usually presents in younger women. So usually you think of breast cancer as a disease that afflicts women beyond their 40s. In Ghana and in many African countries, and indeed people of African descent all over the world, you find women even in their teens or early 20s who are presenting with breast cancer. So that is just one example. Prostate cancer in Black men is also, twice as likely to cause death than in Caucasian men. So there are a number of these, there's a lot of evidence suggesting that cancer presents differently, and in some cases presents more aggressively in people of African descent. But there is currently not a lot of research to explain why this is. And so that is what we are trying to do at Yamachi.
One other key thing when you talk about cancer is the treatment of it. It can be very expensive. Now, your company is investing in cutting-edge biotechnology and even AI. How will that reduce the cost of treating cancer?
So, this is, in some ways you can take it as sort of a slightly long view. If we have better tools to diagnose cancer, we diagnose cancer earlier, that will cut the cost. Many people, unfortunately, in Ghana and many African countries only present to the hospital when their cancer is at very advanced stages. At that stage, it is both very expensive and also the chances of that treatment resulting in successful cure is already diminished. So one of the the ways we are a life science, we're a research company focused on really trying to understand the disease among African people. One of the ways we will contribute towards reducing the cost is by allowing us to develop better tools to diagnose, but then also better tools to treat more specifically. So the quicker you can treat somebody and the more directly you can treat them, you can begin to drive down the costs of care. Additionally, we're also interested in improving diagnostic access. So many of the molecular diagnostic technologies that are available and taken for granted in Europe and North America are not available in most parts of Africa. And so within our work, in addition to our research, we are interested in finding ways to improve access to these diagnostics across the African continent so that people get diagnosed earlier and ultimately not just save money, but save lives.
Right. Yeah, Bediako, scientist focusing on cancer research in Africa. Thank you very much for your insights.
Thank you.